In November of 2020, Oregon voters passed Measure 110, the Drug Addiction and Recovery Act. It decriminalized small amounts of most drugs in favor of treatment options funded by the state's cannabis tax. So how is Measure 110 working, and are there enough places to send people for treatment? Here to answer those questions is Oregon's Behavioral Health Director, Ebony Clark. Before joining the Oregon Health Authority in February, Clark was the Behavioral Health Director for Multnomah County. Ebony Clark, welcome to Eye on Northwest Politics.
Thank you. Thank you for having me.
Well, since Measure 110 passed, we've seen a noticeable rise of open fentanyl use on the streets. Did Measure 110 contribute to that?
You know, what I will say is that, we are climbing out of a pandemic. And so we saw a notable increase at the inception of the pandemic and throughout. And so, I think that the pandemic really just added to the perfect storm of the issues, challenges, and crises that we are seeing. And I will say that in terms of Measure 110 and the impact that it has had on the current, crisis that we're seeing around illicit substance, I believe that it's too soon to have definite data or information to be able to say that there's a direct correlation of Measure 110 to what we're seeing on the streets. I will say that most recently, maybe about a week ago, our Q2 data for Measure 110 was released. And what it showed was that there's definitely an increase in individuals getting assessed for behavioral health services, stepping into services, utilizing peer supports, and harm reduction services. And so when we think about what the data that we do have at the moment, specific to Measure 110, when we think about Q1 versus Q2, we're seeing an upward trend, which is promising, and at the same time, we're early in this investment.
Does the decriminalization, especially of hard drugs, make the Oregon Health Authority's job more difficult?
I mean, I think it makes all of our jobs more difficult. I think that there is a definite sense of urgency as we are continuing to see the issues play out as a result of the illicit substance crisis that we have. And, it takes a collective approach. When I think about Measure 110, part of the aim was to create a process or a strategy to addressing those impacted by or addicted to illicit substance through a healthcare, human-centered approach. Just because, quite frankly, for far too long, we've in society have relied on law enforcement and the criminal justice system to solve for the issues specific to substance use. And so, the goal is to look at how do we take a healthcare approach? How do we create a menu of options? How do we continue to enhance our continuum of care so that we can really start to fill in the gaps, while at the same time leaning in and being intentional in terms of partnership with the various systems that can also impact this crisis that we have. Because what I also
Well, you can finish your point, but I have a question just to follow up on what you just said. Go ahead.
No, I was just going to say that we cannot rely on one system alone. So we cannot rely on the healthcare system or OHA to solve for the fentanyl crisis or the illicit substance crisis that we're seeing. Now, healthcare definitely plays a key and a critical role, but we also have to partner with our community-based providers. We also have to partner with law enforcement. We also have to partner with first responders, and so many more.
Are there enough facilities to send people who are dealing with addiction to the drugs that were decriminalized? Do we have places to send people once we identify the problem?
That's a really good question. We do have places to send folks, but we do need increased capacity because oftentimes there is a wait list. Because when I think about facility-based care or residential levels of care, the beds are full. And when I do think about the OHA, and actually let me back up, when I think about the 21-23 behavioral health investments, that were passed by the Oregon legislature, a lot of it did focus on bolstering and adding capacity to our facility-based and residential levels of care. But when you are looking to build new facilities and, stand up or expand new programs, it's an iterative process. And quite frankly, our system is still impacted by the pandemic, specific to workforce shortage. And so I'd say over the next year to 2 years, we'll start to see this phasing of increase in various levels of care. Because to answer your question directly, at the moment, we do not have enough capacity, and that's what we're focused on building and enhancing.
Yeah, over the past couple of years, the Oregon legislature has allocated more than $1 billion for behavioral health services. What are we getting for that investment now? And I imagine some of that money will go towards creating the facilities that you're talking about now. But what are we getting for the $1 billion that we put into this problem already?
Well, there's a couple of things. We have been able to sustain a level of critical workforce across the state. There were a number of agencies that were struggling as a result of the pandemic, and was at risk of losing critical staff. And so some of those dollars went through, providing increased compensation and incentives for the workforce. We were also able to enhance our continuum of care by also expanding and funding peer support services, because what we know and what research demonstrates is that when individuals are able to receive support from someone who has been in their shoes, it increases the likelihood of them not only stepping into recovery, into treatment, but walking through and completing and sustaining recovery. We've also been able to see a couple new facilities come online, and a couple of organizations across the state expand their capacity. But again, it's very iterative, primarily due to the workforce shortage that's impacting construction, siting, and staffing patterns.
So we still have quite a bit more to do on this problem, but I appreciate you outlining what's been done so far. Ebony Clark of the Oregon Health Authority, thank you for joining Eye on Northwest Politics.
Thank you.